think my responses will speak, one, to what a local health department can do, and certainly as the Georgia Public Health Association represents those team members across the state, then the things that I'm going to say you should be able to find in all 159 counties here in Georgia specifically. So in terms of services offered, as the other panelists have said, certainly COVID-19 vaccines. Now, with that, again, you should be able to find those, or they are available in all 159 health departments. What may vary is the selection of which vaccine is available. So as you know, there was the Moderna vaccine, or I'll use layman's term, Moderna vaccine, the Pfizer vaccine, and then the J&J vaccine. Initially, when we started our response here in Macon in Central Georgia, we only had access to Moderna vaccine. And we were probably 6 or 7 months in before we even got any Pfizer vaccine, and probably 3 months in before we got any of the Johnson & Johnson vaccine. But there were certainly 3 out there. At this time, I can tell you in our area, I don't even have Moderna vaccine anymore. Now all we have is Pfizer. So that selection may vary, but all of your 159 health departments in the state can certainly supply their citizens with the vaccine. The second thing is we also have a ready supply of self-testing kits. I think all of us remember when we were getting tested for COVID early on, there were folks who were like, I don't want another brain biopsy. I'm having them twice a week, because it just felt like the swab had to go, almost to the occipital lobe just to be tested. But we have those tests. And they're readily available to pick up in any health department. And we still encourage people to do it, basically because of the information you provided before on how the transmission of the different variants has gone. So certainly knowing that it's more transmissible now, then we want people to know if they're positive so that they can take precautionary measures. The other place that I think public health at the local level has played a great part is trying to provide accurate health promotion and disease prevention guidance. I think all of us, whether you're the physician, you're the researcher, you're the community advocate, have all had to deal with misinformation as we've gone through these last 3 years. And I think COVID has really put a spotlight on that, more so than any other disease that we have. But I think there are certainly some lessons that can be learned from this COVID experience of how important that accurate health promotion and disease prevention conversations are. And for many of us, it made us have very lengthy, very repetitive, redundant conversations. You felt like you were telling the same folks the same thing day after day after day. But I think those are the things that need to happen to move us forward from a health standpoint. A couple of other things, I think one of the things that public health has helped with, and certainly this is where I encourage the community to become more involved with public health, is certainly hold public health accountable for data. There's lots of data that was collected in the community. I know here in Georgia, initially we were giving vaccines, but we couldn't get information on were there disparities in who was getting the vaccine. Was it, we had a graduated rollout. We started with our more seasoned population. But in terms of getting data, are African Americans getting the vaccine at all? I am very proud to say in Macon-Bibb County, when I look at those numbers, there was a period, probably once we were given vaccines after about 4 months, the number of African Americans that received a vaccine in this area exceeded any other group. And most folks listened to that and they were like, no, that can't be true. We're not coming to get the vaccine. Like, yes, we are. And when that grandmother came to get the vaccine, then she told her son and her daughter and her grandchildren, and they came to get the vaccine. So once one person got it and then began to have those conversations with others and have the right conversation with others, then people continue to come. We started this conversation this evening with the numbers of people that had received the vaccine across the state, and it is certainly not enough as a state from a statewide perspective. But when you begin to disaggregate the data and look at certain pockets within the state, then it is certainly far worse in some places than in others. I would also tell folks, when you're dealing with public health, ask for that data for your community. When you get that data, don't be afraid to ask why, what if, and why not. And I think because of the nature of how COVID came about, the research that had been in place for 10 plus years in terms of developing mRNA vaccines gave us some new, not new, but in some cases forgotten methodologies of how we're able to serve the public. So think about the things of, we were delivering vaccines to the homebound. You know, I'm a residency trained family physician. We had to do that when I was in residency. When is the last time you've seen a physician come to the house? Those things have changed, but the practice still works. We had mass vaccination sites. Think about if we took that method from COVID and said, you know what, we're going to have mass sites where we're going to check blood pressure. We're going to check glucose levels. We're going to check folks that have diabetes, and we're going to check their extremities. You can take those lessons from COVID and move it forward. We saw a great use of mobile units, taking vaccines into the very communities that may not be far from a health department or a healthcare facility, but for whatever reason, those folks would not access the facility, but would utilize the services when they were brought to their community. And there was that trust that was built. We saw several public-private partnerships get initiated and now being sustained to help in this effort. And then the last thing, which I don't think we need to forget, is we also need to look, when we're looking at data, as to who was included, but also we need to do a very honest assessment of who may have been excluded. So when I look at communities, you know, as a health department administrator, every day I get up and know I've got 157,000 people that I've got to watch out for, whether they see me or not. And most times you don't want to see the health department director anyway. But what about those men and women that are in our correctional facility? They may be confined, but they don't need to be excluded. So we wanted to make sure that they also receive the vaccine. The last thing I would say about what COVID has taught us is, and this is a positive, is it introduced public health to parts of the world that had never seen it. And keep in mind, we've had vaccines here. There are parts of the world that still don't have vaccines. And certainly we haven't taken advantage of all the vaccines we have, but I also saw undergraduate students, graduate students across many disciplines become contact tracers. And they were able to engage in public health and move things forward to help in this effort. So I think in those respects is where public health put their helping hand in with COVID. But I think just because we seem to think COVID has kind of shifted or beginning to play out, we still need to stay as diligent as we have been to move those same mechanisms forward.